The bill does. Under the bill before you, the Healthcare Authority is required to convene a work group on establishing a universal healthcare system in Washington. The work group must consist of consumers, large and small businesses with experience with large and small group insurance and self-insured models, labor, healthcare providers and facilities, health carriers, state agencies, and legislators. The work group must study and make recommendations to the legislature on a universal healthcare system that is publicly funded and privately delivered, which includes options for increasing coverage and access for uninsured and underinsured, transparency measures, innovations promoting quality, options for ensuring a just transition for all stakeholders, options to expand healthcare purchasing in collaboration with neighboring states, and options for revenue and financing mechanisms to fund the system. The work group must report its recommendations to the legislature by November 15th, 2020. My partner in this legislation, Representative Nicole Macri, joining me today. Both Representative Macri and many members of this committee have worked quite hard to make sure that we have a good piece of legislation that's going to do important work to expand healthcare access to many folks in our community who are sorely in need of help. We've heard many stories already in this hearing, and we'll hear many more before we wrap up. And I just want to take a few minutes to share why healthcare access is so important to me. When I was a little girl, I was 7 years old when my sister Olympia was born with microcephaly, which is what Zika causes in babies. So that wasn't the cause of Olympia's disability. We didn't know how long she'd live. The doctors were conservative and said maybe an hour, maybe a day, maybe a year. And Olympia ended up living until she was 19. That carried with it a lot of stress about how we would keep Olympia healthy and ensure that she got the health care she needed. Because while my dad had a good job and good insurance, it wouldn't cover everything that Olympia needed to stay alive and to live a full life with my family. But in 1993, this legislature expanded access to Medicaid. And so my family could breathe a sigh of relief and focus on getting Olympia the care she needed. Her insurance would now cover the inflatable vest that kept her from getting pneumonia more than 5 times a year, the wheelchairs as she grew, countless medications. I knew from a very young age that our government had an important role, an important power in ensuring that families like mine were protected from whatever healthcare need came their way. My dad had hepatitis C and ended up dying from complications of liver disease. My stepdad had a severe heart attack. I have friends and family members who have suffered from cancer diagnoses and struggled to pay their medical bills. But my stories are not the only stories like that in this room and in our state. I've heard over and over from neighbors who are worried about being able to make the choice to pay or make the choice on whether to purchase their own medication or their kids' medication every month. We have folks who are drowning in medical debt, and we need to take real action to make a change for our community. This legislature last year commissioned a study from WISP on exploring healthcare options. We'll get the full study in June, and this piece of legislation would allow us to create an actionable plan on how to ensure that despite the constant attacks from the federal level and our inability to access the Medicare and Medicaid waivers we might need to implement universal health care now, that we'll be ready when we do have the ability to get those waivers and to ensure that folks in our community have health care that they can depend on.
Thank you, Senator Randall. Representative Macri.
Madam Chair, Ranking Member Obayan, and members of the committee, for the record, Nicole Macri, State Representative, 43rd Legislative District, I know you don't have much time left and several people signed up, so I'll suffice it to say nearly 500,000 Washingtonians still do not have health insurance. You heard testimony on earlier bills today that many stakeholders are very much interested in engaging with legislators about solutions. This bill provides a pathway to have those conversations, and I urge your passage of it. Thank you very much.
Thank you to you both. We appreciate your bringing this forward.